Alright guys, welcome to the quiz number 576. So here is your question. 32-year-old women. 32-year-old woman is presenting to the emergency department with the sudden painless loss of vision. So how to solve the clinical vignettes? I always say that whenever you have sudden painless loss of vision, that means it is the posterior segment. So you have to think about posterior segment. She is having the type 1 diabetes for 16 years. So she has very good chances of diabetic retinopathy, because you know the most important factor for the development of diabetic retinopathy is actually the duration of diabetes. So you are thinking on the lines of diabetic retinopathy. On examination, her vision is reduced to hand movements, pupillary reactions are normal. Then we also have a vitreous hemorrhage with a limited fundal view. Which of the following would be the most likely causative retinal abnormality? Now, how to go about this question? For this, always remember, if you think about the diminution of vision in the patients of the diabetic retinopathy. So whenever we have got the diminution of vision in the patients of diabetic retinopathy, you have to see whether this diminution of vision is actually sudden or it is gradual. If it is a sudden diminution of vision, it can be in NPDR or it can be in the PDR, right? Now, gradual diminution of vision is due to three things. One is your cataract. Okay, now you have to tell me in the comment section which cataract is most common in diabetes. Number 2, TRD, and number 3 will be diabetic retinopathy itself can also cause. Now, when I'm thinking about NPDR, what is the common cause of sudden painless? Because what is given in the question is sudden painless, right? So, NPDR mein it is the maculopathy, while in cases of PDR, it is actually the recurrent vitreous hemorrhage. Now, what they have asked us is the recurrent vitreous hemorrhage. They are saying that there is a vitreous hemorrhage. What is the most probable cause? Cause is the PDR. So, you have to look for the signs of PDR in the options. Now, if you look at the options are microaneurysms, cotton wool spots, hard exudates, or the neovascularization at the optic disc. So what is the best probable thing for the PDR? It is actually the neovascularization, and simple. The answer to this question will be neovascularization at the optic discs. So I hope you have understood the question. Also the approach, how to go about it. It's a simple thing. The flowchart is always given in your notes. Just you have to remember how to go retrospectively. Thank you and happy ophthalmology.